I think in the interest of time, since we're running over a little bit, we probably will run over a little bit past 3:30, so just be aware of that. I'll give the panelists a few extra minutes to have a discussion. In the interest of time, if the panelists could take seats up here while I'm making a couple of remarks, and then I'll join you and we'll have a discussion. My name is David Barash. As Dawn said, my title is I'm the Chief Medical Officer and Executive Director of Global Health at the GE Foundation. I'm an emergency physician by background and still practice emergency medicine a couple of times a month. The reason I'm here and why I was asked to lead this discussion is when GE came to Boston, we made a $50 million commitment to our community. 15 of those $50 million was to community health. And after a brief investigation of what the needs were in the community, clearly the opioid crisis was number one on everyone's list, that it's the number one public health crisis we had. So we decided that we would make a $15 million commitment to what I call three concentric circles: the opioid crisis in the middle, addiction medicine surrounding that, and then behavioral health. And all three of those, as they fit into particularly addressing the opioid crisis, we're making investments. And in thinking about this conference, I look back at the programs we've invested in so far, and every single one deploys technology in some capacity. We're very focused on increasing capacity to care, particularly community health centers, but anywhere in practice. And so we've leveraged a tool, a platform, I call it an operating system, called Project Echo, which I'm sure many of you have heard of, to enable education, or to enable primary care providers to become educated around opioid use disorder, and in particular about deploying medicine for addiction treatment. And using ECHO, not only here in Massachusetts, our funding is directed towards Massachusetts, but what we've leveraged here in Massachusetts is now enabling us to get Project ECHO to 28 states and over 160 providers around opioid use disorder. The second thing we did is, and this was strictly technology-oriented, is we funded a project through the Massachusetts League of Community Health Centers to develop a system called Drives. And what it is it's particularly a registry for community health centers to begin to enter their patients through the electronic record and keep track of who the patients are that have either chronic pain or substance use disorder. And quite frankly, I was stunned that this didn't exist already, but we helped them create it so now they can see who their patients are at any time to look at who has substance use disorder or chronic pain that they need to address. And we leverage in the same mode of registries, we actually leverage some of our GE expertise, and one of my colleagues, Evan Dana, is here. We actually asked them to work with an organization out of Boston Medical Center that takes care of patients who are homeless, who have opioid use disorder, and we asked them to create a registry for an organization called AHOPE to not only get patients who are at community health centers registered, but the homeless who are getting care for opioid use disorder or are part of this Reach Out program get registered. So the last thing I'll mention, and I'll abbreviate my remarks quite a bit, is we partnered with the Attorney General's office on something called Project HERE, which is around prevention. And with Project HERE, over a 2-year program, we're getting to every middle school with a 3-pronged approach to get to young students about opioid use disorder, about the threats, and about how they can prevent themselves from going down that pathway. One of the key components of that is something called Project HERE Games. And it's an app, it's a web-based app, it's not a handheld app yet, but it's a web-based app where they can get some training on how to behave around their peers, with their parents, with teachers, to learn about how you avoid going down that path of any substance. It could be tobacco, it could be alcohol, it could be opioids. And it's a very interactive app. You can access it free online. Anyone can go on and test it at projectheregames.org. So I encourage you to do that. With that, since we're short on time, I'm going to sit with the panel and discuss a little bit some of the work that they've done.